Now I'd like to learn more about type 2 diabetes. One of the questions I have is it possible for people to have frank type 2 diabetes for 1 or 2 or even several years and not know that they have it?
It is possible. The most common is if they have problems with the post-challenge, meaning after they've consumed a meal. And if their blood sugar rises to be above 200, they may not notice that for quite a period of time. Frank diabetes to go diagnosed for long periods of time, a decade, would be really unusual. Having this impaired glucose for a decade, that's possible. Typically, I would say probably just a few years based on the post-challenge. The impaired fasting, the abnormal fasting blood glucose is not so much that they would go undiagnosed. And the reason is this. At least if they're getting blood work once a year with their family practitioner, you would detect the abnormal fasting then, because it's part of the panel of this comprehensive metabolic profile that the healthcare provider usually is ordering. And that'll get flagged as being abnormal. So even if someone's asymptomatic, it's highly likely that the provider will make note of a blood sugar that's, say, 130 or 131 or 132. Where the dilemma occurs is if this is a patient whose fasting blood sugar looks beautiful, where their problem lies is in the post-challenge. The oral glucose tolerance test isn't done so much in the United States, and that may get missed.
All right. Well, now, my understanding is that type 2 diabetes, even asymptomatic type 2 diabetes, can be doing damage to the body. Can you sort of explain that and go through the various ways that could be harming the body?
Absolutely. So the common complications that we think of for type 2 diabetes, we sort of start from the top and work our way down. So there's eye disease. So it's really imperative that patients who are diagnosed with type 2 diabetes see an eye specialist. It can be an optometrist, an ophthalmologist, as long as they do a very good and thorough eye exam. We're looking in the background, in the retina, and looking at the blood vessels to make sure that there aren't any problems there. So we call that retinopathy. And there are different stages of retinopathy. The one that's most serious, if there are new blood vessels being formed in the eye ground, they tend to be pretty fragile and can hemorrhage and bleed and be a threat to vision. So that's why it's imperative that they have eye exams from the time that they have their diagnosis to at least every year. Their eye specialist can determine if they need to be seen more frequently and need more advanced treatment. So that's one. The other is if you go into the neck, the carotid arteries, these major arteries that feed the blood supply to the brain, they can get accumulations of cholesterol and lead to blockages and have mini strokes and strokes. So it's important that there's an evaluation of risk factors for cholesterol accumulation. So that means the cholesterol profile needs to be monitored, and it should be the complete cholesterol profile. So that's total cholesterol, the healthy cholesterol, or HDL, the lousy cholesterol, as I call it, the LDL, and triglycerides, which are fats in the bloodstream. So that complete panel needs to be evaluated at least yearly. Heart attack, angina, hypertension, and then kidneys, where there's problems. I oftentimes think of the kidneys as fine lace. It's beautiful, it's delicate. If there's too much pressure from hypertension or the blood sugars are damaging the tissue, then the lattice work starts to open up and the kidneys are filtering more than they should be, and you can detect it in the urine. And the primary care provider is ordering these tests to measure how much leakage of protein is occurring in the urine. That absolutely should be done early too. And then for women, oftentimes they can get vaginal yeast infections from high blood sugars. Men can also have infections in the genital area. And then in the legs, you have problems with skin infections, cellulitis, nerve damage to the feet, hands. So those are all the complications that can occur from diabetes. We know that if you can keep the blood sugars in a reasonably good level with the diabetes test, the hemoglobin A1C, and we can probably talk about that in a bit, you want those levels to be between 6 and 7%. You can avoid a lot of these complications.
All right, well, let's go ahead and take the monitoring once diabetes has been diagnosed. How's it likely going to be monitored by their doctor, and what do the numbers mean?
Right. So the way that the patient will learn through either in their offices with a healthcare provider or with a diabetes educator is how often to do the finger sticks. We like to advocate, at least in early stages, if they can do it twice a day and vary the times a day. So fasting and then 2 hours after a meal. So 2 hours after breakfast or 2 hours after lunch or 2 hours after dinner. And it's nice if they could vary that during the course of their monitoring. So not always monitoring at the same time of day. So at least twice a day, varying the times that you do that. That's something that they could do at home, and I ask my patients to keep a notebook. Just buy an inexpensive notebook, keep their blood sugars, and also record what they're consuming. They'll learn quite a bit of the effect of how foods impact their blood sugars. From their healthcare providers, at least every 3 months, they should be doing what we call the diabetes test. What it is, it's a measurement of kind of an average blood sugar, because when the patients are monitoring their blood sugars, they're just getting a snapshot. At that time, this is what my blood sugar was. But this diabetes test, the hemoglobin A1C test, gives you an average level of how well the blood sugars have been controlled for the past 3 months. And normal is usually below 6%. What we consider high, that could be at risk for developing these complications, the eye problems or kidney problems and nerve damage, are levels above 7.1%. So we try to see if we can keep those blood sugars between 6 and 7% on the A1C. What I ask my patients to do, and I write them letters telling them what their values are, is I call it a diabetes test. Gives them an average over those past 3 months. That's something that they should be making sure that they nudge their healthcare provider to measure at that time frequency every 3 months.
All right. Now, what are going to be the recommended interventions here? I'm thinking both lifestyle and medications. Both may play a role,
Absolutely.
right?
So what happens is, if the A1C is definitely over 8%, the recommendation from the national bodies, the American Diabetes Association, is that an intervention needs to be made. You can't just go along and say, okay, things are okay, you're still at 8%. So that means that you need to rethink the strategies for diet and nutrition and exercise, and then may require changes in medication as well, adding more medications, increasing the dose. But we like to really underscore the importance of diet and exercise patterns, because it can just really have a tremendous impact improving blood sugars with minimal side effects in comparison to medications.